Hello, hi everybody. Thank you for joining me right here at 12 o'clock. We're doing a lipedema live interview with Dr. Pennings. I'm going to get him on and we'll get started as soon as he's here. So give me a second. We're going to invite him on. I'm so excited for this. Let's see. Hey guys, 1 second. I'm trying to get our expert here on the line with us, Dr. Pennings. We're going to invite him right into the chat. You guys, sorry. Okay, if you're watching Dr. Pennings, can you request to come in? I'm not finding you to add you into the chat. But okay, so while we're waiting, hello everybody. I have a lot of really good questions that I'm going to be asking Dr. Pennings. But if you have your own questions, drop them here in the little question box, and I will do my best to come around and get those thrown in the mix, because I know there's a lot of questions to be had. Let's see. I'm not finding him. Sorry guys, I'm gonna look for him two ways. Hi! Hello. Hello, hello. Sorry, we're having a little technical difficulty. I'm trying to get Dr. Pennings here. Underscore. All right. Let's see if we're on. Hello. Thank you guys for coming. I'm so excited. All right. Do we have it?
Oh, yes.
Uh-oh, we're spun around.
There we go. There it is.
Hi, Dr. Pennings. How are you?
Great, great. How are you?
Good. Let me turn my volume up. I think I'm a little quiet. Well, everybody's excited to have you here today, including myself. This is a pretty big deal to have you on here.
Well, I'm happy to be here and looking forward to your questions.
Well, I have a lot. I hope that's okay with you. I've got a lot of questions for you. I recently found out that I have lipedema. And so I think along with a lot of our followers and live streamers today, I mean, there's just a lot of questions. So first off, I'd like to introduce everybody. This is Dr. Pennings. Dr. Pennings is a board certified in both family medicine and obesity medicine. He has a special interest in lipedema. So he's going to kind of take us through. Can you tell us what lipedema is, for starters?
Well, thank you for having me. And so lipedema is a condition. It's generally categorized as an abnormal fat disorder, although I think there's some opinions about that it's maybe it's not just body fat that is the issue, because there is fibrous tissue, there is lymphatic tissue that is involved. So it's more of a soft tissue, more of a complex soft tissue disease. It is a condition that we typically see almost exclusively in women. Certain men can have it, typically though if they have like some underlying health condition like liver disease or the such. And we see it in women. We typically see it around periods of hormonal change. So around puberty or pregnancy or perhaps hormonal therapy or menopause are some of the key areas where we see it. And it is a disproportionate amount of this tissue forming in certain areas of the body. We're going to see it around the hips, the buttocks, the thighs, the lower legs, sometimes the lower abdomen. The arms can be involved, upper arms, distal arms. And so we see this abnormal distribution of body fat that is very resistant to dietary interventions. And I think that is the one of the biggest frustrations that women with lipedema experience all their life is they work so hard and try so hard and are so vigilant and diligent about trying to lose weight, and it just doesn't budge, doesn't go anywhere.
I totally relate. That's actually, one of the ways that I discovered I had lipedema. I lived my whole life like this. I didn't know it was a thing until I knew it was a thing. And then you start to realize that it's quite common and a lot of women have it. And you probably know somebody that has it. And as you had mentioned, it doesn't have barriers like race and age. It happens to a lot of people. I know you even mentioned men, but more frequent in women. Is that correct?
Much more frequent in women, and it is very common, and it's much more common than people realize. And one of the frustrations is that people don't know about it, including healthcare professionals don't know about it. So they don't know to diagnose it or to treat it or advise women on what they should do about it.
Yeah, it's still relatively new. So, can you tell us about when you first discovered lipedema?
Well, I teach at a medical school. I'm a chair of family medicine at the Campbell University School of Osteopathic Medicine, and it was actually one of my medical students that came to me with it and first told me about it. She noted it in her body. Her mother had lipedema, and she was asking me about it. I really didn't know anything about it, but it did prompt me to research and learn more about it. And then one of my colleagues in the PA program also is had lipedema, and I started working with her and learning more about it. We actually had a surgeon, Dr. Schutz from Germany, came over and spoke to our class about it, and we did a grand rounds with it, and that was starting my interest in it. And then I just kept reading more about it, learning more about it. I did some work with Karen Herbst, and actually invited her to speak at some of our conferences. I organize the educational content for the Obesity Medicine Association, and so she has come and spoken and worked with her on some projects as well, including the standards of care. So it's been a process of exploring and learning, and then seeing patients for it. I see typically a few patients a week for lipedema, either new patients or follow-up patients, to evaluate them, to diagnose them, to help manage their condition. And so I learn a lot from my patients. I learn a lot from seeing women with lipedema.
Yeah, well, I'm grateful for you for dedicating, like it feels like a whole sector of your practice, and your research and your education to this because, it really helps, especially because a lot of people still don't know about it. Another question for you. What are maybe some of the most common symptoms that you see presented with your patients with lipedema? What can women relate to, and hear that other people may have it? Because I know there's a lot of you watching this today that are thinking, oh my goodness, do I have lipedema? I have a lot of these symptoms. What can I look out for, or what's being presented before you that you see?
So I think that what I described as a lot of the symptoms, so the distribution of that weight, the resistance to dietary change, tenderness, bruising in those areas, that seem disproportionate to other areas of the body. If you feel it, does it feel fibrous? Is there like a bumpiness to it? Sometimes people describe it like when they rub their fingers over the tissue that it feels like a bag of peas or a bag of rice that you're feeling. You get this nodularity, which is the fibrotic component of lipedema. Sometimes there's also larger, more painful nodules that may be larger than pea-sized. So looking at the distribution of the weight, the onset, what was the trigger for that increase in weight in those areas? Is it tender? Does it bruise? Is it nodular? Is it resistant to the dietary changes? Those are all things that I look
And
for.
to clarify, this is different than just obesity or being overweight or carrying some extra weight on your body. There's a very distinct difference.
Right, and one of the things that I see is that when women lose weight, they are losing it not in those areas, but they're losing it around their waist and their chest and their back and their face and neck. So if you kind of draw a U excluding the arms and the lower part of the body, when dietary interventions are made and weight is lost, that's where it's lost, but the arms and legs don't change, or they change very little. And so that is a characteristic that I commonly find. Whereas with generalized obesity, then as the weight goes down, it tends to go down proportionately. You'll see it going down in all areas of the body to the same degree.
Okay. Um, what do we do as far as remedy or procedure to address this? You know, what are some treatments that you recommend for those with lipedema?
So when I look at treating lipedema, I look at multiple different components. So I look at nutrition. In general, I think dietary interventions that certainly limit or eliminate processed foods are important. That lower carbohydrate diets tend to respond better for women with lipedema, not necessarily decreasing the amount of lipedema tissue, but many women will say that when they're following a low carbohydrate diet, their tissue is less boggy, less tender. They feel less swollen when they're limiting carbohydrates, and I think that's all related to how our body uses insulin to regulate our weight. That's another kind of sidebar point. I think anti-inflammatory type diets, Mediterranean diet tends to be low in pro-inflammatory foods or high in anti-inflammatory foods. I think that is beneficial for women with lipedema. So that's some nutritional recommendations that we make. Physical activity is important, and this can be challenging for women with lipedema because the legs are heavy. They just don't move, and they don't move like they used to. And so that can be challenging, but water-based exercises are often very helpful for women with lipedema because the water is easier to move in. You don't have the effect of gravity to the same degree, and the compression created by the hydrostatic pressure of water on the legs helps to reduce the fluid in the legs and helps to reduce some of the edema in the legs. So it's easier to exercise and helps to reduce some of that water.
Things move.
Then I look at behavior. What are some of your food triggers, some of your challenges around foods? That food, emotional eating and why we eat food is often a big factor in our eating habits, that we make our decisions not just around what we eat, but why we eat. And we eat when we're stressed and happy and sad or bored. And then sleep is important, that we get 7 to 9 hours of sleep. And sometimes that's difficult for women with lipedema because their legs hurt at night. And so they have a hard time sleeping. But sleep is an important component there. Medications can sometimes be beneficial, but there really is no data on any one medication intervention. There's a number of different anti-obesity medications. None of them have a profound benefit for lipedema, so that is more tailored towards treating generalized obesity than lipedema per se. But there's also a lot of medications in the pipeline that hopefully one of them will have a more specific effect on lipedema. We talk about certain supplements, and again, I find that too to be an individual response. There's a number of different supplements that are recommended in lipedema, and we try things. One of the things I encourage women, though, don't develop an endless list of supplements that you stay on. It's either going to help or not help, and if it doesn't help, don't stay on it just because it's one of the ones that's listed to supposedly help.
Yeah.
Then we do compression, compression stockings or pneumatic compression can be used, are therapies that are commonly used for lipedema. Referral to a physical therapist for manual lymphatic drainage can be very helpful for some women. Vibration plates can be helpful. I've had a lot of women like the benefits of a vibration plate. So that's kind of a long list of things that we go through to recommend for treating lipedema.
Yeah, it's a lot. I've heard of a lot of those, and there's a lot of different things out there to help. But ultimately, like you said, I mean, it affects your quality of life. You're trying to get sleep, you're trying to do the right thing, and your legs hurt at night, you know, or you're trying to go move and your legs are heavy. So it really affects quality of life, and it limits your mobility. It takes a emotional and physical toll, I feel like. It kind of makes things hard to get the ball rolling. Do you have any tips for women like myself who, like, I mean, I have all the intention in the world to take the first step? What could be an easy first step for someone like myself or women struggling to just do something to help themselves, but they feel stuck?
Well, I think you start off by what is the least healthy part of your diet and eliminating those things. So are you eating a lot of sugar products or drinking sugar sweetened beverages? Are you eating a lot of processed foods? I think eliminating those things is one of the first things that you can do to benefit yourself. I think looking at what physical activity you can do and try to maximize the physical activity that you're able to do, especially if you can do water-based exercises. That can be very beneficial. I think those are two good places to start. But also I think on the behavioral side, recognizing the disease and recognizing that it's not your fault, that your body, your genetics are designed to store calories in that way. It's not your fault that your body is designed in such a way that it is very resistant to losing weight in those areas. There's, and it hurts me so much to when I talk to my patients and hear about them seeing colleagues of mine who have constantly told them, you're just not trying hard enough, you're just not doing enough, it's you have to keep eating less and exercising more, and putting all this blame on the individual that they're not making the effort they need to make, when I know that they've made the efforts, and it just hasn't responded the way other people respond.
Yeah, I agree. I feel like there's a lot of shame and just stigma around lipedema because obviously there's internal things happening that are causing this to be um, within somebody, but also just the the physical appearance of lipedema. It catches people off guard. A lot of women with lipedema don't want to go out and wear shorts. It's summer. It's 100 degrees, and I know a lot of women with lipedema who will wear hoodies and sweats, and they're hiding because they don't want to show their body. And so there is a huge stigma and I guess a shame around it. And I think it's sad because, like you said, it's something that you can't help. And so my opinion, if you're watching this and you have lipedema, I've got the lipedema legs, I've got the lipedema arms, you got to go out and rock it. You are the way you are, and you deserve to be comfortable. If you're out there and you're watching this and it's summer, you deserve to be comfortable. So wear the shorts. That's my take
Right.
on it.
But it is hard because society will make comments and be rude, and it's weight is one of the areas where society still seems to feel justified in being biased and stigmatizing and being critical and shaming people, and that is really sad and unfortunate that that is still an area where people feel that they can justify and call people names and make fun of them and ridicule them, and that's hurtful. It's got to be very painful to go through life like that. So I understand why you don't want to do that, and it's important to let go, at least not be shaming yourself, at
Right.
least not be criticizing yourself, putting yourself down, making yourself feel bad, because those are the things that keep you from wanting to try to make a change.
Yes. Yeah. I found a lot of peace in going to my healthcare provider. At first, it was hard because, like you said, a lot of, well, maybe you had said it, I think you did, a lot of like general primary care providers don't know about lipedema. And so it's kind of hard to navigate that. But once you find the right person, I feel like all of the doors are unlocked and you, like, somebody found you. What a gem. So can you tell us what are some important things that we can look for when addressing lipedema and going to get diagnosed? That initial consultation, help us, guide us. Where do we go? What do we do? What are we looking for in a healthcare provider?
Well, you want to look for somebody that listens, right? Somebody that is not closed-minded. You know, there's a general kind of perception that I see amongst many health professionals that if I can't explain it, it doesn't exist. You know, we saw that for a long time with fibromyalgia. And even before that, we saw that with depression, that people would blame the patient for depression. And then all of a sudden we found that there's really a biological basis of that. There's a biological basis to obesity. And so looking for somebody that is willing to listen and willing to not just prejudge and assume that what you're saying is not true. And if you don't have an open-minded healthcare professional, you need to move on to somebody else that will be open-minded. The Lipedema Foundation has information that you can share with health professionals, and I think that is good information to help explain what lipedema is, how it's different from generalized obesity, that it is a very specific condition that is challenging to treat, but it's important to recognize what it is and what it's not. And so I think sharing that information with your healthcare provider is an important way of getting the word out, because that someone educated me, and you can educate your healthcare provider.
Okay, that's very helpful. So yeah, referencing the Lipedema Foundation, that's a good tool because it's good for physicians to see and reference. I think it's a trusted source. You know, they're very knowledgeable. I mean, I found them off the bat, but also as a patient, I found it to be very useful. Lipedema Foundation, they have a lot of resources on there. And if I'm correct, you're on the board with the Lipedema Foundation? Okay,
Yes.
okay, that's what I thought. Um, so what would you recommend to patients heading into their primary care doctor to advocate for themselves if they feel like their concerns are being dismissed? I know you said go to another doctor. Is there anything else we could throw in the mix to recommend for these women watching today?
Well, I was part of a team that published the standards of care for lipedema, and so that is something that you could recommend. There's also a lot of other literature on lipedema, so looking at some of the scientific studies in lipedema so that you can provide clinical research evidence for the disease, that I think can be a useful also validation of the condition. So I think that's important to be familiar with those, perhaps provide some of those references for your for your physicians, for your primary care providers. I think that can be another tool in addition to some of the resources that the Lipedema Foundation provides.
All right. I know that over 50% of those peer-reviewed papers you had mentioned previously on lipedema have all been published in the last 4 to 4.5 years, which is a pretty big deal, meaning this is a very, it's a disease that's just now, I feel like, becoming more researched and popular. People are understanding it and coming to know it. What gives you hope or makes you feel that there's promise and hope in the future in the field of research for lipedema?
Well, I think there's a lot of attention to it. There's much better recognition of the disease. So I think that is an important part of the process. I think there's a lot of research going into obesity in general. And as I said, there's a lot of new information coming out that I think will help provide, or a lot of new products that are coming out for treatment of obesity that work on all different mechanisms. And one of the things that we are looking for and need to find is something that really helps unlock that fat in the lipedema tissue. So what I find is that, when women gain weight when they have lipedema, they deposit this fat into the lipedema areas. And then when they go to lose weight, it doesn't leave those areas. So it's as if that weight sort of gets locked away into that tissue. And as we come to understand the whole process by which our body stores fat and releases fat, my hope is that we'll be able to find an agent that will help to release some of that fat that is tucked away in that lipedema tissue, so that when women are calorie restricting, when they are in a negative energy balance, that tissue is what will go down in size, and not just the areas in the center part of the body.
So is lipedema forever? Like, I have lipedema. Is this something that I can expect to have forever until the day I die?
Well, lipedema is felt to be a genetic disorder, and your genes aren't going to change. And so, sorry, I wish I could get you. I wish I could give you better information on
Yeah.
that, but I mean, we have to be realistic
Yeah.
about it as well. That is the genetic profile that that you're born with, and that has created the challenge in how your body is storing and releasing fat.
Oh, yeah. Well, I think I'd rather be told the truth and know how to live with this disease and adapt my lifestyle to it, than live in the dark like I did for so many years. I can't tell you how great it felt to realize that and find out that I had lipedema. I thought my whole life that I was just this way, that I was different, that my legs were not so sightly, and I naturally had a small waist and my arms were big, and it was just the way that I was. I didn't have an explanation for it. I didn't know why my legs were achy and heavy and bruisey. For years, I thought that it was just because anemic, or all these different things you try to come up with in your head. So when I discovered that I had lipedema, it was like a light bulb went off. Not that it necessarily changed a whole lot for me, because I'm still going to be living with this, but it just makes sense. It makes sense of what you're going through, all the troubles and the uphill battles that you're facing. And it gives me hope. I have a lot of hope for the future, especially realizing that there are experts and specialists like yourself that are dedicated to the now and the future of lipedema. So yeah, I feel great about it. I feel good knowing that there's resources and places I can go.
And I think what comes out of that is that for years you were probably saying, what am I doing wrong
Mm-hmm.
that this is happening to me? That what am I doing wrong that my body is this way? And learning that it's not something you're doing. It's not something you're doing wrong. It is how your body is designed. And that's not always happy in that sense, that you find out that that's what you have, but at least you're recognizing now that it's not something that you're doing to cause this.
Right. It brings peace. It brings closure, honestly, because then it doesn't matter how much you restrict or you exercise or do all these other things. You can just expect the intent. You're doing it for health purposes, and some things just aren't going to change. So it changes things to be diagnosed, and have that understanding. So, without further ado, is there anything else that you would recommend or advise women thinking that they may have lipedema, what to do today or where to go?
I think that is important to recognize that, to really focus on the health quality of your diet. I think, is most important. Not that it is something that is manageable, and you need to manage it in the right way. And managing it with a healthy diet, with maintaining physical activity, with not engaging in kind of behaviors that make it worse. So overeating or excess eating, or eating foods that are not healthy, highly processed and refined foods that are not healthy. Get used to compression. That's difficult, but
Yes.
it's something that makes a difference. When we put external compression, that keeps fat from forming in that area.
Mm.
So that is a benefit when we have an excess calorie load, our body has to put that excess calorie somewhere. And if you put external compression on, then that keeps it from forming in the lipedema tissue and protects you there. So get used to compression, and the compression should be a pantyhose style compression on the legs, right, from the waist down, not just on the calves or the thighs, but utilizing that compression. And then work with somebody that is familiar with this condition that can help you along the way.
Okay, I have a question. You spoke about the fat tissue. Does lipedema form, let's say you don't have an excess calorie abundance at the end of the day, so you're not actively gaining weight. Does lipedema form in the tissue that you currently have? Is that how it originates? Or does it form when new fat is coming on the body? Does that make sense?
So it is forming, one of the things that we often don't recognize is that our body is constantly cycling through its cells. So fat cells are forming, fat cells are dying, and that cycle is continuous. And so it's more active in the areas of lipedema. At least that's what we think is happening, or what I think is happening is that there's more activity in that tissue. So our body is always breaking down fat and forming fat. And with women with lipedema, it's going to be happening in those areas, in the hips, calves, in the hips, thighs, buttocks, arms, more than other areas.
Okay. Well, thank you. I got really curious when you spoke about that. All right. Well, thank you, Dr. Pennings. I am so grateful for our time here today. I definitely have gained a lot of knowledge and understanding of lipedema.
Well, thank you for having me, and happy to talk about it. It's I think, a fascinating, to me, is a fascinating condition, but I find I get a great sense of satisfaction in helping women just coming to a better understanding.
Yes, I see that, and I appreciate that very much. Well, thank you. And if you're watching this today, you can find Dr. Pennings at the Lipedema Foundation. He is on their board, and so he's got some articles and resourceful information linked
Just
through
to
there.
clarify, I'm a Fat Disorder Research Society board, not the
Okay.
Lipedema
Okay. Oh,
Foundation.
okay. Well, there's still a lot of good information out there, so you can head over to that Lipedema Foundation and get started there. That's where I went, and there's a lot of great resources. So I hope you guys have enjoyed your time here today with us. If you have questions, you can drop them below, and we'll scroll through and try to get those answered for you. But thank you for being here, Dr. Pennings. I hope you have a wonderful rest of your day.
You too. Bye-bye.
Thanks. Bye.